If you haven't done it yet, there's one more reason to get LASIK eye surgery. Dr. Lacani is here from Global Laser Vision to tell us about Intralace.
Hi there, guys.
Intralace.
Intralace, that's correct.
What is it?
Well, we now know that there are a lot of people that are being treated with laser surgery, and there are some people that we used to consider not good candidates. And there's a whole range of people.
You mean like they were naughty?
No, not they were naughty. They're, it's funny, when people come to our office, they expect that we're going to say, yes, you're a great candidate, but a lot of people are, and those that are not are extremely, extremely sad, because they're the ones that really want it the most. And they kind of fall into two categories. The ones with eye conditions, such as glaucoma, retinal disease, or cataracts, and then people with systemic diseases, such as arthritis, collagen vascular diseases, or severe diabetes.
Really?
Really?
Yeah. But the ones that relate to the Intralace are the ones that have thin corneas, and the cornea is the place that we actually do surgery on. That's where you put your contact lens on that sits on the surface of the eye. And in the past, people with very thin corneas were not candidates for LASIK surgery.
Right.
And we now have this new technology called Intralace that allows us to do something for them.
Okay, so Intralace does what physically?
Well, Intralace is basically what we call the all-laser LASIK. It's 100% blade-free technology, and it actually allows us to create a flap that's thin enough because we can design the type of flap we need to make. We use a laser that creates certain pulses just below the surface of the cornea, and those pulses create a plane which then helps us in the critical first step of LASIK surgery called the flap, when we make that flap. People with thin corneas in the past, we were not able to make a thin flap with our microkeratin, which is the blade technology.
But you can now.
We can now. And what we do with the Intralace is we get over a lot of that stigma that people had with having a blade come near their eye. Even though the blade technology is still wonderful, we do it on a lot of patients. It's a blade that's housed in a unit, so no one really sees a blade, but yet that whole stigma of having a blade near someone's eye.
Sure.
Yeah.
Well,
how do you test for it, though, in your office?
Well, when people come in, we do a complete eye exam in terms of medical history, ocular history, to avoid a lot of those pitfalls that make people not good candidates. And then we do a lot of diagnostic testings, including corneal topographies, which looks at the surface contour of the eye, as well as doing a thickness check, and that's the key thing. We have a machine that actually measures the thickness of the cornea. And when that thickness is beyond a certain limit, we're fine. But if it's thinner than a certain range, we cannot do surgery. So then we decide on whether we're going to do Intralace.
Okay, recovery time.
Well,
and does it hurt?
Pain.
And that's the great thing. As I've talked throughout, is that really the LASIK surgery in general is a painless procedure, and the Intralace especially pain-free. Pain-free. The great thing is 30 seconds and it's done. And the nice thing is that there is no sound. It's really silent. So most people think of a blade as moving and lots of sound like a drill in a dentist's office, but it's silent, and so before you know it, you're done.
And how soon do you see then? Like
similar to LASIK surgery, you see pretty well right off the table, but then the next day you're close to your best corrected vision, which is for most
you don't have to wear a patch or
no patches. We do wear
lens.
No, we do wear clear shields so that people can protect their eyes before they go home and sleep, so they don't touch it. But the first thing in the morning, they can take those shields off, and they see actually very, very well.
Does it ever reverse? I'm sorry.
Sorry, go ahead, Joe.
Go ahead.
Thank you. Does it reverse it? Can it ever reverse itself?
The surgery itself?
Right.
Well, it all depends on the prescription, but the majority of studies out there show that the majority of people stay where you're keeping them at really for years on end.
And you're really good at dealing with the anxiety, people coming in with anxiety.
We are, yes, indeed. And we also give them, we talk through the surgery, and we give them a pill to help relax them. Not to knock them out, but just to relax.
Little relaxation.
All right, thank you.
Margarita in a pill. Okay, 1-800-GET-LASIK. No, he's not giving you a margarita.
No.
I'm just joking. 1-800-438-5274. GlobalLaserVision.com.
But you come to my place. I'm serious about the margarita.
Joe,
you come to my place. Dr. Lacani, thank you.
Thank you, guys.
All right.